Welcome back to another episode of Drug Talk. In today's video, I want to quickly go over 3 things that you should be aware of before using Nortriptyline or Aventyl. Number 1, medications like Nortriptyline don't work right away. They take some time to reach maximum effect. After starting Nortriptyline, you should notice some effect of the medication within 1 to 2 weeks, but it could take 1 to 2 months, or in some cases even longer, to realize the effect that you're looking for. For this reason, it's important not to give up on this medication during the early phase of therapy. You should really try to make it to at least the 2-month mark before you make the decision on whether or not this is the right medication for you. Having said this though, some patients will need to stop using Nortriptyline early due to things like side effects and speak with their physician about trying a different medication, potentially in a different class. Despite the fact that some of these side effects resolve after time of using Nortriptyline, some patients may decide to stop the medication due to things like worsening of depression, constipation, angioedema, or even signs of mania. Number 2, there is a black box warning associated with Nortriptyline or Aventyl. This warning is really meant for all antidepressants, which links this warning to Nortriptyline. Antidepressants may cause an increased risk of suicidal thinking in children, adolescents, and young adults who use the medication for major depressive disorder or other psychiatric conditions. This risk must be balanced with clinical need, as Nortriptyline is typically not approved for the use in pediatric patients. So we must monitor all patients using this medication for worsening of depression, suicidality, or unusual changes in mood or behavior. Patients should also be instructed to monitor themselves by doing different things like journaling to really keep track of how the medication is affecting them. Journaling can be very effective because it gives the patient the opportunity to come to an appointment with their prescriber with a list of tangible facts of how the medication is affecting them. And number 3, Nortriptyline should not be stopped abruptly or cold turkey. If the decision is made between the prescriber and the patient to stop using Nortriptyline, the medication must be tapered off slowly rather than stopping abruptly. For this reason, it's very important to keep your prescriber in the loop, especially if you're considering stopping the medication. Working with your prescriber can ensure that you create a proper plan to come off the medication by decreasing the dose slowly over time. You should be aware that if you begin to taper off Nortriptyline, there's a chance that you could experience symptoms of the underlying illness. If this does occur, patients are often told by the prescriber to go back to their prescribed dose and then try to taper it off again with smaller dose decreases. Try not to get frustrated if it takes time to come off the medication. Just do your best to stick to the plan laid out by your healthcare team. And that's all we're going to talk about today with Nortriptyline or Aventyl. But before you take off, I wanted to quickly let you know that if you're more interested in hearing about my story, you can check out my new book, The 5th Episode, Inside the Manic Mind, by clicking on the link in the description of this video. Take care.